with all your patients. Your face, their junk. Okay? I've been up close and personal with more junk than a Playboy photographer. We're talking one who did double duty and also worked for Playgirl. Okay? Been all up in it. Let it go. Okay? You're gonna be in people's junk. You're gonna touch their junk. You're gonna spread their junk open. You're gonna hold it up. You're gonna pull foreskin back. You're gonna pick up their balls. You're gonna touch it all. You're gonna put your finger in there.
I'm
Okay?
sorry, it's just the way it sounds. I know it's realistic, but I'm sorry.
But what I'm saying is,
It's just business.
get
Yeah.
past it.
Yeah.
It can't be a hang up. You're in healthcare.
Do the job.
But he would normally have like
Yeah.
goggles and masks.
Oh yeah.
Oh, yeah, definitely.
Yeah. Oh,
He's not feeling like that.
I mean,
Definitely.
hoe, but you're not a cheap hoe.
Yeah, no.
We got rules.
That
No,
makes it a
no,
little
no,
more
no.
coverage.
Yeah, we always wear our protection. And remember, you're in here because shit ain't right. You know, I have had people walk out of this program. T has seen it because they found out they were going to touch people's genitals. And their girlfriend or their boyfriend wouldn't be comfortable with that.
Dump 'em.
They're here because their
Yeah.
shit is broken.
Yeah.
Okay? I mean, there is nothing sexy or sexual about it. Nothing. Okay? It's these are the same people who get upset when their partner goes in and has to have a vaginal ultrasound and they get mad at the ultrasound tech because they think they're having fun. Nobody's having fun. It's awkward for everyone. You have to get past it. So start thinking about it now. And every time it's a new experience. You never see the same vagina twice. Well, you might see the same vagina twice or penis, but usually not. Okay, I'm ready when you
All
are.
right, can you guys move back that way a little bit, please? So for your,
G.
What'd you do?
why y'all didn't tell me from the get-go?
I didn't notice.
I'm sitting here doing this. See, there's buddy fuckers right there. That's what you call them.
Oh my
So-
god.
So.
Okay, just so you guys know, do you see the problem? He's set up backwards.
Backwards. I'm setting up for a different
Okay? Because he got distracted teaching you. And he knows I let this happen for a
And all
reason.
that has to be on that side. Gotcha.
case. Yes, because so for, we just got done dealing with the Judas. How they move their table is different how you're gonna move your table at first. Okay, and so what we wanna do is this stuff.
So delete all those pictures.
Just admit, if you were in room 2, it would be correct.
Oh, yeah.
Yes, room 2 would be correct.
Because you
we
move the
have to
table
bring the
differently.
table
And we
around
will
over
be
there.
going over there and showing you. But for this one, the table should come straight back.
Straight back.
So we're actually setting up at the opposite end of the table we would normally set up in this room.
Oh, so that's
Specific to just this case because of how he would be pulling forward. And honestly, see, I didn't notice it till you were already basically
I was
set
sitting there
up.
looking too like,
Okay, so he should have just been grabbing the table and bringing it forward.
Turn the table.
No matter
No,
which
you-
way he turns it,
not
even if
gonna
he
do
turned
that.
it this way,
It still should be the right.
Yeah.
his working ends at this end.
on the doc
Not
likes
as
the
close to
tech
the
on the
surgeon.
right most of the time for this procedure. So
He would have had to come all the way around to my left, and I'm a right-handed surgeon, which means he would have been passing across me for every instrument. And on a vaginal case, that's not going to work. Does that make sense? On a belly case, we'd be fine. We'd make it work. Some cases are very specific in their setup, and this would be one of those.
All right, when you come back, check your AKB, my base number, please. Yep.
Oh.
All right, so when you bring your table over, you want to be at an angle kind of,
Sorry.
but you don't want to be. You guys need to listen up. When you pull your table up, you don't want to be underneath your stirrup. Okay, you want to be close, but not underneath. Okay, because we don't want to be too far from our surgeon. Okay. Another thing, part of room setup would be to put our light where it's supposed to be. I didn't do that, so I'm gonna have to ask somebody to bring the light over for me
When would you do that?
when you're setting your room up.
Okay.
When you're doing your room, like pulling your furniture out and all that stuff, just grab the light and put it in an area where it's gonna be and where you can grab it.
Usually we do that when we're moving the head to the foot and doing all that stuff.
Oh.
You have to straighten it out.
He said the light handle.
That's
Yeah,
the most
like-
impressive thing you've done in years. Wow.
We were just going with it. We're like, yep, T says it goes there, it goes there. We're not
So
like,
that's why I have you guys put it there, so you don't forget to put it up here.
Mm.
Because if you forget and the doc goes to grab the light and they're not looking, there's no handle.
Or you go to grab the light because I'm like, I can't see. It's dark in here.
All right, so our stuff is pretty much laid out how we're going to use it. This is an easy procedure. You go straight down the line, okay? Time out. No, before our board would be filled out. So you guys would come in, make up a patient name, but it has to be a first and last name. So Gene will fill out the board real quick.
Oh.
not Tay Tay. She's a Swiftie. I guess so.
We've seen Tay Tay a lot.
Travis is coming for you.
Tay Tay, Beyonce, they're pretty much
Don't use
regulars.
Jane Doe. Get creative. Don't use Jane Doe.
No Jane Doe,
Yeah,
no
no
John
Jane
Doe. I deduct a point if I'm testing you. Lack of imagination. IP Freely, any of those. Go for the oldies, the goodies.
All right. Time out.
Timeout. This is a safety timeout for Taylor Swift. The procedure we're doing is a dilation and curettage, also known as a DNC. She weighs 156 kilograms.
All right.
She has no known drug allergies. That's what NKDA is. No known drug allergies. Our surgical tech is Tavares. Our surgeon is Keisha, and I am Gene. I am your circulator today.
Do you concur?
Yes, I do.
All right.
That
If
looks
you
just
guys
like
want to
her.
come over this side so you can see better what I'm doing, you guys can come around here.
DA is drug and allergies, right?
Yeah, no known drug
Drug
allergies.
allergies, yes.
All right, now, depending on, we have to learn to be ambidextrous pretty much. This procedure, because where I'm at, I'm gonna be passing with my left hand most of the time, but I'm right-handed. We have to learn to be ambidextrous. We're gonna have to use both hands.
How many of you started brushing your teeth with your non-dominant hand? How's that going for you?
It's fun. It's getting everywhere still.
Keep it up. You'll get to soup.
You'll get to soup.
Okay. You notice I didn't have to make any adjustment, even in my wrist, for how he put that in my hand. That is correct.
Can I say it?
Yeah, it's gonna be direction of use, so we're gonna put this in the vagina like that, so that's how I'm gonna pass it.
There is no one way.
Would you like the Kevorkian or sound?
Let's do the Kevorkian. Oh, actually, no. Can I have the Tanak?
Oh, yeah.
Is it fine if the arm falls down?
Don't. Our
Don't.
patience is,
Tenaculum,
broken.
single tooth tenaculum, it's a
Yes.
sharp, okay? So if we're gonna have it out, it needs to be on your sharps pad, okay? When we pass sharps, we do not snap, it's just pressure. We wasn't ready?
I thought you were gonna show it twice,
Oh.
not do it and let it go.
So, just pressure, just let the doc know that it's in their hand, cause a lot of the time the doc is focused on what they're doing and they're just gonna hold their hand out. Whatever you give them, they're gonna go straight to use it, okay?
Oh, the avant you have to lay on the belly when you're playing surgeon. If you try and hang it on the bed, well, obviously it's not gonna fit in our mannequin vagina. If you try and hang it on the bed, it will fall on your toe. It will. Not if, will.
I'm sorry if this is a silly question. So if she asks for a sharp,
Don't reach over my table, please.
sorry, you take it from there.
Don't point
Don't
over
point.
the table.
So go ahead,
You
talk.
take it from where the instrument is, you set it on the sharps pad.
No, I could put it there or I could leave it here, either one. I just showed you guys you could put it here if you want to.
Oh,
If you
okay.
take it out, it
Right.
has to be on here.
You can't take it out and lay it over there.
Yeah, it needs to be
Or lay
on
it
the
up there.
sharps pad because it is a sharp. That's the
Okay.
only reason I did it. I would've took it out and brought it straight to her hand.
Okay.
Okay, I missed that.
It's just if you take it out of the lineup, it has to be
go
on
over
there.
No,
If-
no.
It
You
can't-
guys are thinking too much into this.
You're making it harder than
So
it has to be.
either I can say, say this is, I agree with my double tooth. If I wanna leave it here until I'm ready to use it, it has to go there.
When he was setting up, you
Yes.
could have taken it out and put
Put
it
it right
right
there.
Okay.
But if I don't want to and I just wanna pull from here, I'll just pull from there.
Okay,
Sorry,
gotcha.
I just wanted to clarify.
And most of the time, if we forget something, it's no big deal. We know where it's at, just grab it from there.
Got it.
That's why putting your instruments back in the right place is critical. Your teammate will hate you if you don't. Okay,
Kevorkian sound?
please,
Which one?
Kevorkian.
Okay, when I pass this, it's gonna be pencil style. I want her fingers right in here and the basket up. Okay?
Okay, when he passes this to me, I know it's in cutting position because of this cutout. So that's why he's cutting me in so I can grab it right
And-
here.
And when you guys go to pass, Kay's just showing you like how you should start. It should be one motion though. Don't do this.
Don't
Okay.
stab
Yeah,
me.
so when you go to put it, she's just showing you guys that it's one motion. Okay?
But you see, my finger immediately goes there, so I don't even have to look at the tip. I know it's ready to go. That's what that tells me.
Okay, now she has her, this is gonna be her endocervical curettings. So we have that curetting. After we pass that, we automatically grab our telpa and our absence so we can get specimen.
Can you get that tissue that's stuck in there? Okay, for those who cannot see, he was getting the tissue out
Of the
of the
basket.
basket of the curette. He's not reaching into the vagina. No, bad tech.
And the gauze or the
Telpa.
talpa.
Show them how you were
it
reaching
touched
it so they
that.
could see what you were doing.
Yeah, so what I'll do is,
Excuse me.
she'll put it on my telpa, cause she just, got the
Okay.
specimen out, and I'm just gonna pull little pieces out of that basket.
Okay, I just wanna make sure it's okay that they touch.
Yes.
They're both sterile,
Okay, perfect.
okay?
Okay.
Squeeze past
If you're trying to pull tissue out of the vagina, you're doing the doctor's job. Stop. It's not for you. Okay?
Right, is this a specimen?
Yes, it is.
What would you like it called,
Endocervical curettings.
and how would you like it sent?
Routine at the end of the case. Okay, so I'm sounding for depth. That has to be done before I can use any of the intrauterine instruments. So doctor's gonna put the sound in until they feel it hit the fundus of the uterus. They're gonna mark it with their finger. They're gonna pull it out and look at it. Now they know how much they can put in.
Oh.
That's what they do.
Now I'm dilating. We're gonna go through this process pretty quickly. In the real world, okay, our patients are prepped for a DNC or they're experiencing a spontaneous abortion. If it's spontaneous abortion, their cervix is soft and opening, and we can't stop it. That's why they were losing the baby, right? The fetus, the products of conception, is not a baby. Done a lot of these, never seen a baby. If this is a patient who is coming in for a scheduled DNC, they'll usually go into the doctor's office the day before and they'll place a seaweed plug in the cervix. I don't know how chemically that works, but there's a hormone in this certain type of seaweed that they make these plugs out of, and the body absorbs it and it causes the cervix to relax so it's softer and more pliable. So we don't even use probably the smallest of the dilators, thank you. And even as we go up in size, it takes a second. You have to sit and let it dilate around the item. So we're not slowing down that much.
And I like to put mine back in order, so that,
So when
when the surgeon is throwing it, isn't they contaminated other?
Last one, nope.
No.
Because nothing, this touching everything that's sterile. All this is sterile. They can toss whatever they want.
The only thing on it is the patient's cooties.
What if they throw it and it lands on the floor?
You can just leave it there and say you're bad. So I let her know when I have my last one, okay? What size curette would you like?
Medium.
Do surgeons always toss it when they're done, or do they sometimes hand it to you to put back on the table?
They may hand it to you. or
He
they
should
may
have
like
the
put it
next
there.
item in his hand.
Yeah.
He should not be
Oh.
If
having
you notice, I was
time to.
passing with one, fixing with the other.
Should we announce the size of the dilator when we're handing it?
No, you can ask what size and just give it to him.
Okay.
Is this a specimen?
Yes, it is.
What do you like it called?
Endometrial curetting,
How
sharp,
much do you like it sent?
routine at the end of the case.
So when you're saying that, is someone, it's like the circulator doing any kind of information?
Yeah, they may be listening, but we're hearing it from the doctor firsthand, so I'll let my circulator know. I'll let Jean know, hey, I have a endometrial curetting to go
Oh, okay.
at the end or whatever.
And usually they're listening. They have a lot of paperwork to do for specimens. So the circulator should be getting the specimen bags ready because you're going to need 2. They have to have a label for each bag and tell the lab what to do with the specimen on that label. So they're filling that out. They might even have other questions. Not usually on a DNC. It's usually identify, but yeah, they would ask any questions they have at that point.
Okay, now, what happened then, just now when I gave Kasia the sponge stick, she took off the tenaculum, tossed it back up here, that's gonna cause her to bleed. So that's why I handed her a sponge stick.
Because remember, I grabbed the cervix with that thing. I poked that into the patient's cervix. So there's 2 poke holes in the patient's cervix where I took that out.
Okay, now, if you notice, I passed the sponge stick first, then close this. It doesn't matter which one you do first, as long as this gets closed. It is a sharp, it should be closed all the time, okay? And then back on your sharps pad is fine. And if you notice, my table looks pretty much like when I started.
Yeah.
I put everything back pretty much because if they're dilating or something and they go back to the last one, but I got them all bunched up in my, I'm gonna have to take time to look for them when I could just lay them back like they were and give them the number or the size they want. Okay? Once we are done with that, the doctor is done. Can I do my count, please?
Sure thing, laps,
0.
free
Oh,
tags.
you want to give me mine back?
Oh, yeah.
I forgot about that. I'm done.
All right. 1 on the field, 2 on the stick. Notice I'm pointing where they are. 2 on the stick. 3, 4, 5, 6, 7, 8, 9, and 10.
Blades,
0, excuse me. 0,
hypos,
0,
clothing,
0,
scratch,
0.
handicap.
1, 2, 3.
Your count is correct.
Doctor counts correct.
Thank you.
All right, once we let the doc know the count's correct, we're gonna come back here. With these towels that are up here, we're gonna take these and wipe the patient down, okay? And then we're gonna pull all of this down. Get a hold of it. That goes in the kit bucket, then
Sometimes
off.
they just stick.
and in the kit bucket. Okay, then what we would do is we would get exam gloves. We would get a wet and dry towel, wipe all the betadine off the patient, and then we would ask the circulator if they needed help repositioning the patient. If they don't, we'll go ahead and take care of our table and make sure everything's good while they're doing that. If so, we'll we'll have our gloves on and we'll help to reposition the patient back. Okay? Most of the time, for this procedure, not so much, but we want to stay sterile until anesthesia says we're good. Just in case something happens to the patient, we're still sterile and we're still set up.
Okay.
So if we need to go back. So just keep in mind that we usually won't scrub us until anesthesia says we're good. Okay? And then we can go ahead and take care of our stuff.
Okay.
So the test ends when we're done wiping down the patient?
Yes,
Okay.
pretty much. So at the end, we'll have you guys wipe down the patient. Then I'll have you tell me what would you do next. And it would be, I would grab a wet and dry towel, wipe the patient down, ask the circulator if they need help with repositioning the patient. If they don't, I would take care of myself.
Okay.
Okay? No, that's a lot of information.
Yeah.
And we'll be in here to practice with you guys. But we do like you guys to do this on your own also.
Okay.
Playing surgeon, you can ask us questions, but if you're the surgeon and you can feel how it should be in your hand, that teaches you how you should pass it.
Okay.
If you know how to receive it and you know what it feels like.
I missed this part at the beginning. How do we work the hydraulic on the table?
You don't.
You don't.
It'll be
It'll
set
be
for
us,
us.
yeah.
The
Oh,
bed
okay.
will be, the bed will
Yeah,
be
you guys don't
like
have
this
to.
the whole
Oh,
time.
okay.
It's not that
Okay.
hard.
Yeah, it's
Okay.
nice,
With
it's
pictures.
pictures and everything, so. you
Oh,
can-
okay.
but, yeah, you guys don't have to worry about,
Okay.
So we don't have to
setting the
worry
table.
about
You
putting,
guys do
them.
have to put those
we
on.
put the stirrups
Yes.
on.
You
Okay.
just don't have to worry about lowering the bed.
And you
or
need to take
anything.
the stirrups off at the end of every case.
Yes.
Okay.
When you notice it gets to be easy
Just the
to leave them on.
Just the stirrups off or also?
All of them.
All the
They're-
whole
yep, the
thing.
whole thing.
Okay.
So you guys can get used to putting them back on.
Okay.
Okay.
So when we do that final maneuver, are we throwing the towels away too, or?
Yeah,
we
those
dig it-
towels are gross. They
Okay.
got all kind of blood and we don't wanna wash those. We just throw them
Vagina
away.
blood.
Yeah.
Ew.
Yeah, all of the blue towels pretty much are disposable. We just
Okay,
throw them
and
away
then
afterwards.
when we're doing the supplies ones, those are just going into that.
Yeah, you
bag?
can put those in that garbage, yeah, and then just take them out when you guys are done. Just
Okay.
don't, try not to put any garbage, real garbage in
That's
there.
OR garbage.
Yeah,
Yeah.
just on the stuff that
Reused
we're gonna
stuff.
reuse.
So yeah,
Okay.
it doesn't actually get messed up.
Okay.
You know, if you throw glove wrappers in there and then as you're going
Yeah.
through your stuff, you need to move those, do that. But that, at the end of the day, should be empty
Uh-huh.
if everything's packed back up and put away.
Mhm.
The clean garbage.
Gotcha.
Okay.
Sweet.
Yeah,